You're someone with a vision for your practice, for your side hustle, and for your personal journey. But when it comes to establishing your path on how to get to where you want to be with your practice, things get a little messy. You're also someone who'd prefer to go in person instead of to groups and listening to everyone else's story. To me, it sounds like you could benefit from one on one consulting with our experienced practice of the practice consultants. From $5.95 a month and up, you can work with a consultant that will give you more direction and practical, tried and tested tips matched to you and your goals. For more information, visit practiceofthepractice.com/apply. Again, that's practiceofthepractice.com/apply.
Hello, and thanks for tuning in. My name is Andrew Burdett, and I'm one of the consultants with Practice of the Practice. I own a small hybrid group practice based out of Asheville, North Carolina, and we provide some in-person and mostly telehealth across the state of North Carolina and to some additional states as well. I really enjoy helping practice owners set up and manage a set of systems that work well for them both in efficiency and cost effectiveness. I also really like to help find ways to maximize how they currently work so that they can spend more time engaged in what they love to do outside of therapy and the therapy process. You can schedule a pre-consulting call with me at practiceofthepractice.com/apply, and I look forward to meeting with you sometime soon. Hello, thanks for joining us on the Practice of the Practice podcast. This is Andrew Burdett, taking over hosting for Joe Sanok for episode 928. My guest today is Kim Skelton, who runs a practice in Asheville named Widening Circles, and their focus is ketamine-assisted treatment. And let's have her intro a little bit about how she got started doing ketamine-assisted treatment.
First of all, Andrew, just thank you for having me on today. I am Kim Skelton. I'm dually licensed as a licensed clinical mental health counselor, supervisor, and a licensed clinical addiction specialist. I've been in the field since 2005. I have been in some form of private practice since about 2010, going full private practice in 2013. So Widening Circles, it is an integrative treatment and consultation practice. And we definitely, a large part of what we have woven into that integrative treatment since about 2017 is, ketamine. And I've also become involved with the Pearl Psychedelic Institute, where I am currently offering MDMA assisted psychotherapy for PTSD under an FDA expanded access program. The first time I offered ketamine in my practice was with a psychiatrist that I was formerly in practice with in probably 2017, utilizing an IM or intramuscular route of administration. I got really interested in working with psychedelics. I mean, I've always, been interested in psychedelics in general, as long as I can remember. But, just looking at the research and then seeing how it plays out with clients, especially ones that I'd already had, a pretty in-depth therapeutic relationship with, just to see how much traction they've been able to get, really just put it over the top for me, where I started, spending time and energy and, just resources that I have, trying to learn as much as I can about it. I love this topic and could go on and on about it, but maybe if you could guide me a little bit of just what you're curious about or what you think your listeners might be curious about, I'm happy to share.
Yeah, let's back it up a little bit. And you mentioned doing full-time private practice, I think you said in 2013. And what kind of setting were you in before that just kind of make the decision to move into private practice?
Sure. So I would say the first 8 years of my career, I was in some form of community mental health, whether it be intensive in-home or community support team, school-based mental health. And then I moved from the Atlanta area to the Asheville area, and I got a job at an FQHC, which stands for Federally Qualified Health Center. So I got a job in the Asheville area doing that. worked there for a couple years where I met the addiction psychiatrist that I eventually went into private practice with. We just got to be good friends, had similar treatment philosophies, and we put together a small mindfulness-based program focused on opioid use disorder. And so we started that in 2013. And yeah, here we are today, 10 years later.
Got it. For a number of our listeners, some of the people listening to this are going to be curious about how you incorporate multiple disciplines into a private practice. And so can you speak a little bit more about some of the logistics it took to incorporate a prescriber? I know in talking with you outside of just in general, just talking about widening circles too, I know at least in North Carolina where we're both located, there's some complications around how you add extra disciplines to a professional LLC or S Corp. And so can you speak a little bit about some of the nuances and logistics with that?
Absolutely. When you first go into a thing, you do not realize all that you do not realize. So I've learned a lot along the way. I'm not sure where all listeners are located, but like you said, here in North Carolina, there are some laws around the type of professional licensures that can incorporate together. In speaking with the medical board, when I originally began my first practice or private practice, Willow Wellness and Recovery, we basically had to have both the North Carolina Medical Board and my board both sign off on that. And the medical board informed me that here in the state of North Carolina, in order for a practice to offer, quote, the practice of medicine, that you have to have someone licensed by the North Carolina Medical Board that is at least 1% owner. Now, in addition to that, we have some contractors, like we have a functional medicine contractor. And so our medical director, who is an MD psychiatrist, she does all the supervision for anyone who, like, we have a couple of PAs who do prescribing. So, yeah, I would definitely speak with someone who is knowledgeable about building medical practices. Just having a solid attorney that you feel like you can fall back on, what they have to share is helpful.
So when you went from Willow to Widening Circles,
Mm-hmm.
in terms of kind of creating a new thing out of that, which is again more ketamine focused, if I understand right, would you kind of categorize for anyone that's out there looking to do any of the psychedelic assisted stuff? Are you maybe more heavily classified as a medical practice versus a like therapy practice? I know that we're all kind of medical and clinical in terms anyway, but one of those being a more kind of social talk therapy oriented thing versus a traditional medicine sense of things. So is Widening Circles, just given the nature of the work, the primary focus, is it more of a medical practice with therapy as a component, or is it more therapy practice with medical component?
I think that is an excellent question. That there are trainings that will go on and on about the differences. I guess the first thing I'd like to lay out is, and I will answer your question, but I'm still kind of formulating this as a much larger question that we hold in this field. So traditionally, like mental health prescribing and psychotherapy have not necessarily been at odds, but they've been very different, and not always in the same practice together. Um, with psychedelic assisted psychotherapy, there is necessarily, both components are present at the same time. There are quite a few key differences, I think, in just your more conventional treatment paradigm and then a psychedelic medicine paradigm. Namely, in a psychedelic medicine paradigm, it turned this idea of, an all-knowing professional that you go to see completely on its head, and so how does that, factor in with being a medical practice and the way that, medical services are looked at and experienced by people? It really is both. And that's why, I consider us an integrative mental health practice, because it is. I can't, you could work with a psychiatrist outside or a prescriber outside of the practice, and come up. People are being very creative about ways that they're doing this. I, however, and the folks in this practice, we've just found that we really enjoy working as a treatment team. I guess if you look at it, some of our languaging has begun to shift from only being client to being patient, just because what's required now that we're going through different levels of accreditation and having to write out prescribing protocols. So it is a heavier on the medical side than many practices I've been in. But similarly, with the practice that I had previously, we utilized medications like buprenorphine, or some sort of med-assisted treatment in conjunction with psychotherapy. So, in some ways, it's not all that different, but this does feel a bit more medical, because we are like checking people's vitals. There's a prescription involved, than maybe just a more traditional psychotherapy practice.
What does a typical course of treatment look like for someone that's interested in having a ketamine assisted or psychedelic assisted, depending on the state? But since we'll just limit it to ketamine and how you all do this, what's a typical kind of experience as a client?
Yeah, so a typical experience would be someone would come in, and do an initial biopsychosocial with me or with one of our other therapists that's trained in ketamine assisted psychotherapy. If we feel like, based on what they have going on in their life, that they would be a good fit, then we will have them do an evaluation with one of our prescribers, typically our psychiatrist. And then if she feels like they're a good fit, I'll meet with them, do some preparation. The way we do it at our practice, for every single person that comes through for their very first KAP session, both the prescriber and the therapist sit in the room with the client. And we're both there for support, for medical support and, therapeutic support. And then we do an integration within, I would say, 24 or 48 hours, which is a session afterwards for us to just talk about everything that came up. Depending on, that first session for them, typically, their treatment team, which is always their prescriber and therapist, and sometimes there are other treatment team members too, depending on the person, a neurofeedback specialist or a coach. But at that time, after that first initial KAP session, we'll discuss, what is it that, well, first, how did you respond to this? Does this seem like something that could be efficacious for you to help you with your presenting needs? And, if you look at most of the research that has been done, most of the research has been done, starting with 6 sessions or so. And so a lot of our people will do 6. It's, because we are so individualized, I have some people who've had many more than that. And then we've certainly had people that have come in and were just interested in learning more about it, learning, could this be a good fit for them? So yeah, that's typically sort of at least 6. And then some people will do like an ongoing maintenance, if that's, because for people who have dealt with pretty severe treatment resistant depression, they may find that having one once a month or once every 3 months, a booster of sorts, can be helpful, to help them maintain gains.
And when you're talking 6 sessions, are you talking 6 traditional therapy sessions plus a KAP session, or are you talking 6 KAP sessions?
6 KAP sessions. And in our practice, we primarily use intramuscular. I'm happy to talk about different routes of administration, but just for ease, simplicity, efficacy, we typically stick with just intramuscular. And the person will have about 4 to 6 actual ketamine sessions where they have one of our prescribers gives the injection, and then we're there with them the whole time. And then however many integration sessions that a person might need, after that, we kind of work it out with them and come up with a unique treatment plan. But that's sort of generally how that will go. I do want to name, we, for the first time not long ago, piloted a ketamine assisted psychotherapy group. where we had multiple people, and we had multiple providers and multiple patients present at the same time. And it really was beautiful. So I'm really, just looking at doing that kind of work in a community of peers, with people who tend to be pretty isolated anyway, because of that level of depression. I feel really hopeful for that, both therapeutically, and in terms of accessibility, being able to serve more people at the same time is certainly an option to try to make things more financially accessible.
Got it. I went to an open house at the Pearl Psychedelic Institute, and they talked a little bit about the different methods of, I guess, induction would be, or just or administration, I guess, is probably the more medical form term for that. But what can you talk a little bit about the different routes of administration for ketamine and how they might differ, and then just kind of what
Sure.
the overall experience and timeline someone can expect for how long ketamine might be in their system and what the kind of arc of experience might be?
Yeah, that's great. I will start with talking a little bit about IV. So, intravenous, where someone is hooked up to an IV for 45 minutes to an hour. And with an IV, you get a very steady stream the entire time. So there's not like where with some of the other routes of administration that I'm going to talk about, there is this curve, with of onset and sort of coming back down, but with IV, it's just a steady state sort of the whole time. And like I said, most of the research began using zero point 0.5 milligrams per kilogram of like a human's body weight. And, more research is coming out now, where we're seeing a wider range of that, maybe 0.5 to 1.5 milligrams per kilogram. So ketamine is a dissociative anesthetic. And so when it's used in anesthesia, we're looking at more like 8 milligrams per kilogram versus in psychiatric indications, it's much lower, like 0.5 to 1.5. So just wanted to have some frame of reference. That helped me when I learned that part. So I've mentioned IM or intramuscular. That's very similar to if you go and get a COVID vaccine. So the trajectory for IM, the way that it's primarily different than IV. I mean, obviously, it goes into the muscle instead of a vein, but it basically is sort of like a rocket ship that shoots you up within 2 to 3 minutes. I mean, a person is in it and then slowly comes down over about 45 minutes. And so the peak of it is, usually like I would say, and it varies depending on a person's metabolism, but generally within 10, 12 minutes, a person is sort of at the peak of their IM experience. You've also got what are called troches. And for people who aren't familiar with troches, they look sort of like a Hall's lozenge. And those are taken sublingually, where you hold it in your mouth. It's a much slower onset. So where that IM will come on in 2 to 3 minutes, the troche or lozenge takes more like, 12, 15 minutes. They don't taste so great. A lot of times, if people are prone to nausea, the troche seems to bring that up for people a bit more than the IV and the IM. We've also got intranasal routes of administration. And so, for the listeners out there, there is one form of ketamine that has been FDA approved for treatment resistant depression and like acute suicidal ideation, and that is called Spravato. It is an intramuscular, yes, and I'm sorry, it is not intramuscular, it is intranasal. But that's not the only intranasal that's available. Depending on your prescriber, right now, a lot of this has to be called into compounding pharmacies anyway. You can get compounded ketamine. Ketamine is old, it's pretty cheap, but I don't work for a drug company, let me be clear about that, but it does cost significantly more. This newer, Spravato costs a lot more than if you were to just get the intranasal ketamine. And really, research seems to be showing us, and what's bearing out in practice is that, I mean, I don't even know if I can say this, but this is just what I see in practice, is that Spravato doesn't really seem to be superior in any way to just your generic intranasal compounded ketamine. You can edit that out if I'm not supposed to say that.
I'll put a little note just in case. So you mentioned a couple of different sets of symptoms or just descriptors about like where someone, treatment resistant depression, and I think you mentioned like acute suicidality. When would somebody find or be seeking ketamine? Where's the kind of measure of where ketamine might be a worthwhile consideration versus just something to experience maybe outside of a more clinically informed setting?
I think the answer to this question is going to continue to change. I think that presently it's sort of looked at as that thing that you might do somewhere before TMS and ECT. But something that we're finding is that, with our more traditional antidepressants, SSRIs, mostly, those can take, 2 weeks to be efficacious for people. For the percentage, I mean, I've seen rates 20 to 40% of people, those help, depending on what study you're looking at. Whereas, with ketamine, it's pretty rapid decrease of symptoms, pretty much immediately treating them. And, you don't have to take it every day. So, I do wonder, like, will it become more of a frontline treatment, where, why do we need to exhaust all these other things first? It's very safe. I mean, it's given to children and sort of, medically compromised folks for anesthesia in much higher doses, So it'll be interesting to see sort of how this bears out, in practice.
As a therapist, I can tell you from experience that having the right EHR is an absolute lifeline. I recommend using Therapy Notes. They make billing, scheduling, note taking, telehealth, and e prescribe incredibly easy. Best of all, they offer live telephone support that's available 7 days a week. You don't have to take my word for it. Do your own research and see for yourself. Therapy Notes is the #1 highest rated EHR system available today, with a 4.9 out of 5 stars on trustpilot.com and on Google. All you have to do is click the link below or type promo code Joe on their website over at therapynotes.com and receive a special 2-month trial absolutely free. Again, that's therapynotes.com and use promo code Joe on the website. If you're coming from another EHR, Therapy Notes will also import your demographic data quick and easy at no cost, so you can get started right away. Trust me, don't waste any more of your time and try Therapy Notes. Just use promo code Joe at checkout.
You mentioned TMS and ECT. ECT, I believe, is electroconvulsive therapy, and TMS is
Transmagnetic stimulation, or we should look that up. But it's like transmagnetic stimulation. It's basically like, it looks sort of like neurofeedback, but like heavy duty.
got it. That's kind of what I was thinking. Was there's also a transcranial thing, and there's a couple different.
I think that might actually be it. Transcranial magnetic stimulation.
Got it. Yeah, I know very, very little about either one of those things. I know a little bit about neurofeedback and stuff, but not a whole lot about TMS or ECT. So it sounds like for people just acute level stuff. If I'm trying to like be a little deliberate with like my words, like if someone was maybe not at that level of acuity and was wanting to seek out ketamine as an option for them, say like they've got persistent anxiety or like anxiety attacks or panic attacks or phobias, like is it something that KAP's accessible for somebody looking to address those things, or is that just too off label at the moment?
I mean, it's still technically off label for everything that we're using it for in terms of psychiatric indications. We just have more research right now, using it for treatment resistant depression and acute suicidality. We're also seeing it be really useful with other things like OCD. I have seen, that could be a whole episode in and of itself, probably. But of just because psychedelics and ketamine in general, help with cognitive flexibility, I think that there are a lot of potential indications that we're still learning about. And I think, to go back to your question of, like, how acute does someone need to be? I think this really brings up a question of insurance, medical necessity. I mean, I think if someone, seeks out a quality provider that doesn't have to necessarily provide a diagnosis, I think so long as there's nothing that's obviously contraindicated and that prescriber feels like it's medically appropriate, I think that there will be a place, for people to, maybe they're seeking personal growth, maybe they're went through a hard time and just need to have, I don't know, a different sort of retreat experience where they do a deep dive. I'm not here to say what should or shouldn't happen, with insurance companies and whatnot. It'd be interesting to see how that goes, but and what they will require as we learn more. I mean, there has been, the FDA has been, there is a CPT code that has now come out. I mean, it's not currently being utilized in billing, but, there is a CPT code that has been created with the idea that eventually that would be a code that is able to be used to bill insurance. So I don't know what that will look like. We'll see.
From the sounds of it, it sounds like insurance is playing catch up in terms of trying to catch up and figure out how this fits into the whole paradigm of everything.
Because it's just a different model. I mean, we don't typically, I mean, you and I every day see people for, our 50 to 60-minute therapy sessions. But, if you give someone a super bill with two, 90837 codes, I mean, an insurance is, they'll might reimburse you one of those,
Mhm.
or the patient, but not both. I mean, it's just doesn't, this modality of treatment, we have not found a simple way to integrate it into, the model that currently exists here in this country.
Got it. You mentioned contraindication. So when would somebody not be a good fit for ketamine assisted treatment? What are some of the rule outs?
Some of the rule outs, like, so some of the medical rule outs would be things like, uncontrolled hypertension. Like if someone has had like ongoing urinary tract issues, like with cystitis, that kind of thing, because long-term use, I think, of ketamine can exacerbate it. Let's see, in terms of psychiatric indications, right now we just do not have enough research to look at using this with folks who have psychotic symptoms. There is some thought that for someone that has an underlying psychotic disorder, that this could kick that up. And so this would not be your first line of defense, in working with that. A caveat with that is, you wouldn't want to use it like in bipolar disorder. It is used some in bipolar disorder, but it's typically used in bipolar depression, rather than if someone is manic. There is some caution with like a very complex trauma history, just sort of depending on someone's ego strength and the supports that they have in their life, So some of that's going to be clinical judgment, and it's not hard and fast, but those are some general things you want to look at as potential contraindications.
Knowing that ketamine's a popular recreational drug, how do you approach someone that has a substance use history that's clinically significant in relation to ketamine treatment?
Andrew, I love this question. As someone, I know we're both dually licensed, working in mental health and addictions. And I've gotten that question many times, like, hey, how does this factor in if someone has, an underlying, substance issue? And the first thing that I want to say is I do not feel that using psychedelics in therapeutically is a contraindication for someone who is in recovery. I wouldn't do this with someone who's actively like using heroin. I mean, I need to know that they're somewhat stable, and have some supports and that kind of thing. I very much come from a harm reduction perspective. Number one, So I think anything that reduces someone's harm and moves them in, a positive direction is positive change. We are seeing research come out using ketamine with alcohol use disorder. There's an older study that looks at using both high and lower dose ketamine for like opioid use disorder, looking at rates of abstinence at different time intervals after that. To me, I hearken back to like the Gabor Mate sort of idea that a lot of this is rooted in trauma. Like a lot of what we see is rooted in trauma. And with addiction, to me, I very much view that as the opposite of being present. You're trying to be anywhere other than present with whatever it is that's ailing you. Whereas with psychedelic medicine and going into these spaces in a therapeutic way, when you have someone holding space for you, the idea is really just the opposite. It's that you're as close as you can possibly be to like that capital S self, like if we were going to use IFS language, where you're right there, like deep, just truly deeply with whatever is, so I don't see a contraindication, a necessary contraindication there.
Got it. I know the Pearl Institute's come up a couple of times. You want to talk a little bit about what the Pearl Institute is and kind of what sets it apart and how it fits into the broader realm of ketamine and psychedelic assisted research and treatment and stuff?
Yeah, so the Pearl Psychedelic Institute is located in Waynesville, North Carolina. The executive director is Dr. Raymond Turpin. He has been passionate about psychedelic medicine probably since before I was born. He has been following this and, is become friends with people who are leaders in the field and has really created, I think it's an incredible model. So, like, where my business is, a for profit organization, the Pearl is a nonprofit, and they exist for a few reasons. Number one, is like offering high quality training, in ketamine assisted psychotherapy right now, and in other psychedelics as they become more into mainstream and into the legal treatment space. The Pearl also, has received some grant funding to offer some subsidized treatment because right now, I mean, that really, I would say that cost is likely the largest barrier at this time, to this kind of care. Let's see. And so right now, also with the Pearl, they are one of two expanded access sites in the United States offering MDMA assisted psychotherapy for PTSD. And so I am one of the co therapists under that program. We're currently serving 3 patients undergoing this care. Yeah, so the Pearl is, everybody works hard and cares so much about bringing these things to people that need it most. Yeah, so like we have for an example, we're running a ketamine assisted psychotherapy training later this week, so those are for, so anybody that's out there that would, is interested in like an introduction to this sort of thing. We do offer a 3-day introduction to ketamine assisted psychotherapy that includes didactics, and then a couple of experientials as well as part of the training process.
Also, I want to add for those listening, they're at least NBCC approved. They may be approved for other boards as well. So if you're looking for continuing ed and are curious about it, you can come out to the beautiful Appalachian Mountains west of Asheville and check it out and have a weekend retreat and get your continuing ed in too. Outside of a weekend like that, where are some good places that for people that are more curious about this? And I appreciate you mentioning kind of the history of this too. This goes back to certainly the 60s with people like Stanislav Grof and transpersonal psychology, and Timothy Leary fits into this whole picture, and I'm sure Alan Watts to an adjacent degree. And, so there's what are we talking, like 60, 70 years at this point worth of research and interest in this that's kind of recently been allowed to resume study after a lot of years of just kind of being an outcast, an outlier in the whole war on drugs picture and kind of stuff. MAPS, can you kind of identify what the MAPS acronym is? Because I can't ever remember it. And if there's any other organizations like MAPS that if someone's interested that's out there listening wants to learn a bit more.
Absolutely. So MAPS is the Multidisciplinary Association for Psychedelic Studies. And they really have spearheaded over the past 20 years the vast majority of the MDMA research that has come out. And so they, in terms of our expanded access that I was sharing a little bit about, MAPS and Pearl is partnered with MAPS to be able to offer the expanded access treatment. I feel like was one of the questions you were asking, like other places to seek out some treatment, or not treatment, I'm sorry, like training or learning about it, or
Yeah, if people just wanted a reference of places to start learning more about this, or if they're already kind of starting to learn more about this, thinking this is something they want to start offering as part of their services, outside of MAPS and the Pearl, what else might be some other organizations or reference material they can start with?
I did my ketamine assisted psychotherapy training with an organization out of Colorado called PRATI. It stands for Psychedelic Research and Training Institute. Love them, love their mission, very drawn to them. It's about, people and the planet, not just, a big focus on trying to create some meaningful delivery systems rather than like, extractive capitalism kind of thing. But there's some other great training programs too. There's Polaris that's out of California. There is Sage Institute, which actually now Sage, their nonprofit training arm is called Alchemy. So they're also out of California. There's Fluence out of New York. And then there's another training program in the Western North Carolina area too called Living Medicine Institute that's put on by another wonderful psychiatrist here in town, Signe Goldman. I really love the organization Chacruna. It's Chacruna. They do lots of trainings on social justice oriented topics in psychedelic medicine, ethics. I love them. Everything I've done with them has been great.
Well, as we kind of start to wrap up, is there anything that if somebody's thinking about adding this as a service line for them, or just looking to kind of maybe coalesce around a group of other practitioners and stuff, what would kind of be the main checkpoints if somebody wanted to start thinking about this from a clinical standpoint and from a professional to offer to clients?
Sure. I think just in the beginnings, if you find yourself interested, I would definitely pick up the book, The Ketamine Papers, that came out in 2017. There should be a new one coming out. I don't know if it'll be next year, but it's in the works. I think that's a great place to start. I think networking with people who are already doing this, either in your community or in some community that is adjacent to you. You really want to identify like who are the folks who are doing this, with authenticity and with impeccable ethics, and really begin to align yourself, with those people and kind of see what's already being done. Yeah, there are people that have been doing a lot of work with psychedelic, not just ketamine, but for ages, and so I think just beginning to align yourself with some people that are respected in this field, I think is a great place to start, because then you start being on listservs. And, there's a great listserv if you are already a provider called Big Tent Ketamine. That's got, providers from all over the US and really some from other countries too. But that's a great resource. When I have a question or, hey, has anybody ever done this way or seen this thing? It's a great resource. And there's people on there that, probably famous people that you've heard their name, but it's helpful to get, feedback, from the larger treatment community.
Very cool. Well, anything else you want to make sure listeners take away from this, or like what's your, I guess, big takeaway or couple of big points you want to make sure listeners remember as they kind of process this and integrate it?
I think if you find yourself interested in this, again, just seek out connections with people you trust. I think, honestly, the Michael Pollan book, How to Change Your Mind, I think made a lot of people aware of these kind of treatments. So, yeah, just start there. Like if you don't have kind of that basic knowledge, start there, and talk to people, who are already doing the work. And there's a lot of great resources out there. Feel free to contact, either Winding Circles or the Pearl, if there's anything that we can do to help. But I'm thrilled to see the field moving in this direction.
Very cool. All right. Well, really appreciate you coming on. This has been fun to interview. Looking forward to getting a chance to go grab coffee or dinner at some point sometime soon
Oh,
too.
yeah.
That'll be lots of fun. I know we're both super busy doing our own little practice things all the time. So, but I really appreciate you taking the time, and I just also sharing all the depth of knowledge you have about this, because I know it's kind of actually wild to think. I was realizing a week or so ago, like Angela and I have known each other for like 6.5 years. And that's probably when we first met, when I was looking for an internship site at your
Yes, I
other previous
remember.
place. Yeah. So it's been kind of fun on a very distant sideline, kind of watching your career progress and having this kind of become your niche and your area of expertise and stuff. And it's been really great to like talk with you and sit with you at different points and just hear your perspectives on this or the future of treatment or supervision or other things like that. It's been really nice. So thanks for sharing all of this. And be sure to include links and stuff like that in the podcast description to both Widening Circles and the Pearl, as well as some of these other groups like MAPS and some of the other ones you included as well. So thanks so much.
All right. Thank you so much. I really appreciate it. And I'll see you soon.
All right. Sounds great. Thanks for tuning in and listening to my podcast takeover for Practice with Practice. If you made it this far, thank you very much. If you'd like to talk more about our topic today and find out more info from our guests, please check out the episode description below. And if you're interested in learning about working with me, head over to practiceofthepractice.com/apply and schedule a pre-consulting call. I'll look forward to working with you sometime soon. Thanks.
You know, we also couldn't do this show without amazing sponsors like Therapy Notes. Therapy Notes is the best electronic health records out there. They will help you switch over from your current EHR. They also give you 2 months for free or just money off if you use promo code Joe at checkout. They are phenomenal. They help with automated billing. It's going to make it easier to outsource your billing. So many reasons to switch to Therapy Notes. Just head on over to therapynotes.com, read about it, and at checkout, just use promo code Joe. Thank you so much for letting me into your ears and into your brain. Have a great day. I'll talk to you soon. Special thanks to the band Silence is Sexy for that intro music, and this podcast is designed to provide accurate and authoritative information in regard to the subject matter covered. It is given with the understanding that neither the host, the producers, the publishers, or guests are rendering legal, accounting, clinical, or other professional information. If you want a professional, you should find one.